All right. Well, look, I'm very excited today. It is a first time appearance of someone I have admired for a long time, Jennifer Freed, who is an entrepreneur, CEO, just a role model to every innovative person in healthcare, for women in healthcare as well, specifically, who have really done so much. Jennifer, we're going to actually make a formal introduction. I know that we caught you at some major conference that you are at, so I want to apologize to listeners if there's a little bit of a noise in the background because you're so busy. So getting any time with you is always a privilege. So, as a first time appearance on Healthcare Unfiltered, tell listeners a little bit about you and really a little bit more of a background to until the point where you decided to form your own company.
Well, you are too kind in your introduction, and you left out the most important part, which is that now we're neighbors. So that's the
We
best
are
part that I get
neighbors.
to
We
see
are
you a lot more
neighbors.
often and go find all of the good coffee shops in the North Shore of Chicago. So thank you so much for having me. It's a pleasure. So for anybody watching this that hasn't met me, I'm Jennifer Freed. I am most recently the co-founder and CEO of Explore Surgical, which I think we'll get into today and talk about. Um, I have been in Chicago now for the past 15 years plus and have spent my career initially as a consultant at Bain. And then after that, kind of going back and forth as an early stage healthcare technology investor, but also operator, entrepreneur. And it's been a privilege to see and be a part of so many great emerging health tech companies that are going out and changing the world for physicians and for patients and for the entire healthcare ecosystem.
Jennifer, help me understand a little bit. I mean, in our lifetime, or we go to school and we get a job and raise a family or not, whatever it is. What happens that you one day you decide I'm gonna find a company, like I'm gonna create a company?
Yeah.
I tend to believe that this is not something that just occurs easily.
No.
Like what happened? You woke up one day like, okay, I'm gonna, tell me how this happened.
I, you know, I wish it was that simple, but I feel like it rarely is. So, I've always been so excited and passionate about healthcare because it's something that just touches every one of us, whether we like it or not. We're going to go through the healthcare system. Our loved ones, our family, our friends are going to go through it. And so I've always been fascinated by healthcare and found it just so meaningful, but also so broken in many ways. But for me, I never had the desire to, pursue a clinical degree. I didn't have the calling to go out and, be a physician or be a nurse or, work in the healthcare industry in that way and take care of patients. But I've been fascinated by the business side of healthcare, the finance side of healthcare, and the innovation. So Explore is absolutely not my idea. I take no credit for it. The concept was born out of a research lab within the Department of Surgery at University of Chicago by my co-founder, Dr. Alex Langerman. And so I met him in 2013, and 2 years prior, he had founded a research lab that was dedicated to studying operating room workflow and operating room efficiency, or the lack thereof, as we like to say. And so Alex had seen so many challenges in his own day-to-day as a surgeon around how was the OR run. So how do you coordinate an entire team of people to take care of a patient when you constantly have new people coming in, new products, new procedures that you're doing? So the vision for Explore was firmly Alex's. And so I met him when I was in graduate school at University of Chicago. And I was there to focus on pursuing a career in finance. That was my plan. I'd been kind of a math and business and finance person, and that was what I wanted to do. And moving on to the investing side of healthcare, it's incredibly important to know what's happening in the best healthcare institutions. So a lot of what I did as a student was go around and talk to different physicians and see the research that was going on at a university like University of Chicago. There's so much that's happening and there's so much innovation and just really groundbreaking research. And so I met Alex when he was giving a talk, And when he described how chaotic the OR could be at times, I honestly didn't believe him. So, he was describing a world where, as much as 50% of the time, he would have somebody brand new in his operating room that wasn't familiar with the procedures or the step-by-step, or how to do a certain case. And, he would describe these disruptions during his case where he would have, 5-10 minutes, sometimes longer, where he would have to completely stop a surgery with the patient open on the table while somebody left to go get the right instrument or get the right tray or get something set up. And as at the time an outsider to the operating room, I just said there's no way that this is happening, right? And there's no way this is happening that often at such a great institution. And so what Alex did was he invited me into the operating room to see it for myself. And just, this was 2013. So this was before HIPAA was, as pervasive as it is today. So you couldn't go and do that today. So there was a moment of time where I was able to go in and register as a visitor to the OR and go in and watch surgery and see what was happening. And I saw it for myself. And, in those weeks and months following getting to know Alex, understanding his research, understanding his dedication to improve patient outcomes, I became firmly convinced there was a problem. But it was never that I woke up and said, oh, I'm going to found a company, or, oh, I'm going to, be an entrepreneur and start something new. This was something that, initially took months for me to say, yes, I believe this is a problem, and it's a really big problem. It's a problem that's large enough to go out and be a venture capital backable business. But it actually took me several years before I was ready to commit full time and say, I'm ready to dive in. I'm ready to take this on. I'm ready to take the risk and leave at the time, a very good, stable career in finance to go and build this business. And it was because I was so passionate about it.
So let's go back a little bit about the problem. I heard
Sure.
it seems, I mean, for the listener out there, it appears to me it's chaos in the operating room.
Not all the time.
Which is not, I say that
it
because
can be.
Because it's not reassuring. Like if I'm a patient, obviously, I would be concerned hearing this. So I believe I want to make sure that we convey it's not really
Yes.
that chaotic, but it's not perfect. So when you went into the operating room and you visited with Alex, what did you observe? Give me like top 3-4 things that you really were surprised about.
Yeah. So, I think, and the way that I like to describe this to, fellow OR outsiders, I'll say, is the thing that surprised me the most walking into the OR is from a patient perspective, you think about going in there and you say, okay, well, there's a surgeon and there's an anesthesiologist and, maybe there's a nurse or a tech helping. So the first thing that surprised me was the sheer number of people that are in the operating room for any given case. So a lot of the cases that I went into, you would have probably on average 6 or 7 different people that were part of a care team that were in that operating room, that were part of, taking care of that patient. So, you'd have the surgeon or the attending surgeon. In the case of a teaching institution, you'd have a resident or a fellow. You would have a circulating nurse. You would have the scrub tech that was there. You'd have the anesthesiologist. You might have other students or people that are there observing. But the other part that was surprising to me was seeing the representatives from industry. So, in more than half of surgical procedures, you're going to have a representative that's there from the medical device company that's there to support the case. So as an example, if you're coming in and you are getting a knee replacement, you may see somebody from the company that manufactures that knee replacement who is going to have a medical device representative from their team that's in the room. So that was very eye-opening to me to see just the sheer number of people that were in the room that were all, working together as a team to take care of a patient. So that was very, very surprising. So that was kind of the first thing to me was, wow, you're really coordinating a lot of people at one time to take care of this patient. And, the thing is, in surgery, it's a team, just like it is anywhere else. So if you think of somebody that, works in an office or, I'll say when I was a consultant at Bain, you work with a team of people on a project. If you are working with the same team of people doing the same types of projects over and over again, everything is very smooth, right? You know how the other person's going to react. You have a playbook that you follow, the step by step, how to run meetings, who's the person that's always going to show up 5 minutes late, with their Starbucks in their hand, right? All of those things that make you a team and work together. And so one of the biggest challenges that, I see in surgery is if you can't have a consistent team working together, that's where you start to see some of these pieces fall apart. And Alex did a lot of research on teamwork in the operating room, and how having a highly consistent team, can, I don't know if I'm allowed to officially say this, but I think ultimately the belief is that having a consistent team improves outcomes because you reduce those delays and disruptions. You are able to anticipate each other. And so I think in a dream world, you would have the same team working together all the time. But the reality is that that isn't the case. So, you see turnover in hospital settings, upwards of 30% a year. It takes a long time to train people. In teaching institutions, you have new people coming in and out. You may have new sales reps that are, coming into the room to support cases. But also, you're constantly evolving your care. So you have new devices that you're using. You're taking new techniques. You're working with new products, or you may have different approaches. So, that's one of the amazing things about our healthcare system is I think there has been so much innovation in the medical devices that are available to surgical teams. But if, as an example, you take a procedure that used to be an open procedure with a very large incision, and now all of a sudden you say, we're not going to have that large incision, but we're going to take a small incision and use a camera and go in there and use much smaller instruments. It's a big change in workflow. It is a big change for that team, and that requires a lot of support.
So you obviously identified all of these issues, and then the next step, was it to study the process flow and look at these things and how they happen, and then to create a system to optimize everything happening in the operating room? I guess, how long did it take you after that first visit until you said, you know what, I'm ready, I need to try to fix this? And we all know, Jennifer, that sometimes when you go on this, you're taking a risk because you can't really guarantee success. So take me through your mind. Like, how do you balance? What's your risk tolerance? How do you really decide, I'm going to really go all in? And like you said, maybe leave a career that is a little bit more steady and stable and put a lot of effort, human capital, financial capital, and really mental capital into it.
Yeah. So, Alex had formed the research lab 2 years before I met him, and he had been doing research in this again for years. So there was already a strong foundation of this is the problem, and Alex had done a lot of that legwork. When I met him in 2013, I think he had just gotten a small grant from the Department of Surgery for about $10,000 to hire a computer science student to start to build up the very first prototype. So when I met Alex, he was working on this very early alpha version of a product. And when I met him, it was very much an idea. And I think where we complemented each other was, he had such a deep understanding of the pain point from his own practice and had captured all of this data on the problem. And I came in and was ready to help write a business plan and say, okay, let's take this step by step. And so the timing that worked, to my advantage was I met him at the beginning of business school. So I wasn't working full time. I was in school full time for 2 years. And we were able to kind of go step by step. And University of Chicago as an institution actually had a lot of support and resources there to help us. So, we worked with the I-Core program, which is this really great customer discovery program through the National Science Foundation, University of Chicago, where we were able to get some money to go out and talk to prospective customers and talk to different team members in the OR to do some more customer discovery. We were then able to go through the Innovation Fund program, where we said, okay, we need a real alpha version of this that is better functioning. And the big thing for us was we wanted to have a very intuitive user interface, because the OR is, as you know, complex enough as it is, right? If you hand somebody a tablet and they have to click 12 buttons to get to something, it's never going to get adopted. And so we then said, let's go and really invest in our, UI UX design, and create something that's really easy to navigate. And so we had all of these wireframes, and I remember like we had this initial version that was basically like a landing site, and we could only have one procedure, so it wasn't even like a real software platform. But we were wheeling in these big TV screens into the OR and asking everybody in the room, saying, what do you want to see? How do you want to see? What types of pictures would you like to see? What's useful? What do you hate seeing? What's annoying? So we did a lot of that work when Alex was at U of C. And then we started to say, okay, we understand the problem. We have a very early kind of alpha version of our solution. Now we need to go and get data to validate that this actually works. And that's where we went through the National Science Foundation and their SBIR program. And so that is a fantastic program that is run by the government. We were able to apply for small grants for scientific research. And then we received a grant from them for about $225,000 for that kind of first phase of research, where we then hired a real tech team. A lot of it was contracted out, but we did bring in our chief technology officer in-house. And then we were able to actually do a study at University of Chicago, where we had the resources to say, let's go and measure all of these things of what an operating room looks like without Explore. Then let's go put Explore in and actually measure the outcomes and say, we believe that having a software platform like this can reduce those intraoperative delays and disruptions and prevent, some of those opened and unused disposable items that are so expensive for the hospital. Let's go and actually prove it. And so those were some of those initial steps. And it wasn't until we had that data back, which was very, very good and very encouraging and exciting, that I kind of felt ready to take the plunge. And the other thing that drove me to do it was, just really realizing if I didn't do it, this was going to go away. And so, we weren't at the stage where, we had so much that we could come and hire in some super experienced CEO that, knew what they were doing to come in and take it and run with it. I think it really needed to be founder led. And so the answer is it took years for me to get there, and maybe it would be different now, but I really had to get to that point where I felt like my baby's gonna die if I don't go and do this.
Jennifer, just to step back just a little bit, you mentioned Explorer a lot. Obviously, I know where it is, but I just don't know if the listeners know.
Sure.
Like maybe describe it. Is it a hardware, a software device? Like what? Because what you're saying is it's an actual instrument that is helping physicians and OR staff to optimize their workflow and minimize waste and all that stuff. But what is it?
So Explore, it's a software platform, and Explore is a digital and remote case support platform. And there are three main components of what Explore does. So the way that Explore is delivered, it's a software platform. You can run it just on any web browser, but most of the Explore customers today use it on iPads. And so you can have different iPads or different screens in the OR that run our software. And so the three things that the software does, the first is map out step by step how to do a surgical procedure for each team member in the room. And so this is really important for new procedures, for new devices, and for new team members. So if somebody's been doing a case all the time, they don't need this. But if you have a brand new device that is coming in or a brand new technique, this is something that everybody in the room can look at. So the scrub tech in the room, who's the person that's responsible for passing all of the instruments, the surgeon is able to actually see right in front of them on a screen in a sterile bag. So everything is sterile. hey, here's the 4 instruments that, you need to get ready off of the Mayo stand. And this is really important because there can be hundreds or even thousands of instruments that are in a room for a case. And so if I come in and say I'm a scrub tech that normally all I do are orthopedic procedures, I could be really, really great at my job and know every single instrument. But if all of a sudden, hey, it's 3 p.m., the shift has changed, everything's running behind schedule, I get thrown into a neurosurgery OR. It's not that I'm bad at my job. I just haven't seen all of these things before. And so it's meant to be a tool that's really helpful for new team members. That's, imagine a playbook that is visual, that maps out each part of the case. The second part of what the software does is capture data. And so as you progress through the case, we capture all of that information around how long does somebody spend on each step of the case. If you are, doing a study, so you're bringing a new product to market and you're trying to understand, hey, how many times did it take for somebody to place this correctly, or what angle did they use for this approach? You can easily document it right there in real time. And then the third component of what Explorer does is offer remote case support. And so you can actually have somebody that is an expert or somebody who's learning who just wants to watch a case, not be physically in that room, and they can see everything that's happening. They can capture data as they're watching the workflow. And that was something that we added later to the platform, but became during COVID, as you can imagine. So that's when we added it, because we had such demand from our customers. It became, I think, probably the most popular part of our platform, because it was harder for people to get into the OR, especially for the team members that were from the medical device companies.
Yeah, that's amazing. So you had the idea, you have the software, you have the technology, and now you are gonna, you want to found the company, you want to found the company, and do you go and pitch this to investors, to venture capitalists? How difficult was it? The process of like preparing a pitch deck, and how many people laughed at you, and they said this is
a lot.
Right. But I think it's important for people who are listening to realize this is really not a walk in the park. I mean, you get probably a lot of people who rejected this and like, okay, whatever. But take me through that process. And
yeah,
and there are so many VCs. I actually interviewed a partner in a VC firm who is very, very inspiring and impressive. And he told me his name is Lee Shapiro, and he works for Seven Wires.
yeah.
He told me that his firm gets 2,300 pitches a year. 2,300 pitches a year. I literally, my question to him was, I said, how many minutes does it take you after the pitch starts before you know whether you're going to go in or out? Because frankly, you may have like a 30-minute presentation, but within 5 minutes, an experienced investor knows. Take me through that process, the difficulty of it, identifying the potential investors. And did you need to put some of your own money into it?
Well, yes, I did. And, so if we back up, I had been working at a healthcare venture fund. So the actual, hey, putting together a pitch presentation and putting together a financial model, that wasn't challenging for me because I had spent so many of the past years, reviewing them. So that part wasn't challenging for me, but I think I went into fundraising very optimistic of, hey, I know what I'm doing, and I've, sat as a VC on this side of the table. This should be a walk in the park, and it absolutely was not. And so, when you talk to Lee, he says, okay, we see 2,300 companies a year, but how many does 7Wire invest in? I think I'm sure it's less than 10 per year.
You're right.
So it's a very, very small percentage of this company. So as a founder, when you're going out and pitching VCs, a lot of it is a numbers game. So you have to pitch a lot. So for our very first round, I wanted to go out and raise $3 million to get this started, because our initial approach was selling to hospitals. I was really confident that we could add value, but I also knew it was going to be a long sales cycle. And so you have to buy yourself time to get off the ground and get started. And I pitched over 100 different investors, and we ended up cobbling together just under $1 million. And so it's $970,000. That was a mix of 19 different investors that it took for me to pull it together. And it was extraordinarily hard. And I think overall that's actually a pretty good hit rate, right? Like 19 over 100 is pretty good. And there were some things that I knew how to do that I think improves that, which was really focusing on who are the right investors to talk to. So a lot of pitches that VCs get aren't the right fit, either because they're not in their focus area. So, somebody may say, I just don't invest in healthcare companies, or I invest in healthcare companies, but not healthcare software companies, or I don't invest that early. And I got some of that wrong, but I think I had a network of, okay, I know who the people are that are writing this size check into companies like mine at this stage. It was really hard. I had a lot of people just say, you're totally crazy and this is never going to work, and you have no experience as a CEO, and you're 26 years old, and what do you think that you know about surgery, and all of these different things. And it was really, really hard and disheartening. And sometimes I just said, gosh, what am I doing? Right. And so ultimately we were able to pull it together. And once we had raised that round, that's when I knew, I'm committed. So I take fiduciary responsibilities incredibly seriously. And at this point, we had taken about $1 million of outside money. And a lot of this was from people that I knew really well as my business school professors. I didn't have a lot of money, but I put, as much of my own money as I could into the company. My parents wrote one of the very first checks into the company to, help support and get it off the ground. And so that moment, I took it really seriously. And I said, if I hadn't been taking it seriously before, like now this is the time. And I have to do everything I possibly can to make this business successful and to make sure that I return that capital, hopefully many times over, to all of these investors that are taking a bet on this company. But at that stage, they're really making a bet on me to lead it.
It's really, listening to you is amazing. First of all, I think there's the perseverance, despite rejection from a lot of people when you're trying to invest, is really important. But I love what you say about the fiduciary responsibility, right? Now that you have other people's money, whether somebody gave you $20,000 or $100,000, it was their money, and they put their trust in you. They basically believed in you. And
you can't just walk away from that.
You can't walk away. So it puts a lot of on you. Now, $1 million may appear a lot of money, but me and it's probably not a lot of money when it comes to really getting a company, because you have to hire employees, you have to bring people. So you got the first round of $1 million.
Yeah.
What were your first few steps after you got that money?
So for us at that point, this was 2016, it was, we got to get this in more sites. And so I knew we wanted to start selling it and getting some revenue, because at that point, we had kind of our first, I'd say, good commercial offering. It wasn't like a great commercial offering, but we had an amazing CTO that had built a software that had a lot more functionality than what we had before. But I think the big step was we need to see this in use. And so we had that data from the University of Chicago, but that was for just one type of general surgery, right, in one setting. And that's where I said, okay, if we're going to go out and raise more money, and we're going to have to do this pretty soon because that $1 million isn't going to last us that long, we need to see what Explorer can do in other settings. And so that's where, we ended up working with, I think it was 5 initial provider sites. And we said, we need to see this in different surgical specialties. We need to see how this works in different procedures. We need to see how it is outside an academic hospital. We wanted to look at surgery centers. So that was my big mandate, was I want to go out and meet with as many, thought leader surgeons that are interested in using a product like this, and operating room directors that are interested in innovative technology platforms, and just get people to try it. They didn't need to pay me. I just wanted them to try it so that I could really say, this is how much of a difference Explorer can make so that we could then go out and start to commercialize later on.
But how, I mean, how, I guess, how do you decide on hiring people to help you with this? Because obviously people want to get paid. And, $1 million with benefits can probably barely make you hire enough people to really scale up what you're trying to do, which is going to a lot of sites, including community hospitals and other sites. So do you just hire like one or two people and see what you could do? Do you contract? Like, how do you build a model that, because you still need more money. I mean, that's
Oh yeah. So it was me. I mean, I was like the one woman commercial
you're
shop,
the
and
commercial person, the CEO, and everybody.
yeah, I mean, our full-time team was, I don't know, like maybe 4 people. It was really small. And so a lot of the investment was in technology. And so we, our chief technology officer, we had hired full-time before that, even before I joined. We were able to do that with the grant money. And his team was primarily offshore. And so we were able to, manage our costs in a way that were appropriate for the business at the time. But I mean, it was me, like I was hustling. I mean, I can still tell you, like, the ways to get to the OR director's office for like 50 different hospitals. Like, send me to Stanford. I'm like, okay, like I know this is a little back staircase that has the 5 steps and here's where you go. I think they got sick of seeing me all the time, just showing up like, hey, but I was a road warrior. I mean, that's what I did. I went and met with all these surgeons. We had a junior team member who was terrific. And one of our strategies was trying to find the surgeons that were doing research. So like we had Alex, and we're like, how do I find more Alexes that are out there that are passionate about solving this problem? And so we had gone on PubMed and looked for physicians that were publishing research on this topic. And that was one of the techniques that we used to try and find some of these initial doctors to say, do you want to try this in your operating room and see how it works? So that was really what I was doing. But then the reality was, so we closed that round, I think it was August of 2016. By February of 2017, I had to go out and start raising more money because we had about 6 months of runway at the time. And so it takes a little while to close around and find those right investors. So, I mean, I was running for those 6 months, trying to get more sites. And, we had a lot of part-time people that were helping us support those sites, getting it up and running. We worked with a lot of residents, med students, and then also post-bac students. That was a terrific source of talent. We worked with post-bac students from Northwestern, who were so smart and also just so eager to be in the operating room. So we had to be really scrappy and creative.
And then your second round was easier. How much you were able to raise for second round?
So our second round, easier in some ways, not in most ways, harder than others. So we had gone out, and this is 6 months later. We had half a dozen sites or so that were up and running. So we had people that could talk about the usability of the software, the value. We had the data back, from the National Science Foundation. And I had originally thought it would be kind of an extension to a seed round. And this is where it was interesting, because I was running the business from Chicago. And so I was pitching to investors in Chicago, of which there are some, but it's not a huge number, but also investors on the East Coast and West Coast. And once I went to the West Coast, I got the feedback of, hey, Jen, for a healthcare IT company, this is actually a Series A company. So, you have a product, it's deployed in half a dozen hospitals, you have data on it. Like, you're not commercial yet, but there's really something here, and this is a Series A business. So, oh, that's interesting. It's a very different kind of set across the markets. And so we had multiple term sheets by, I think it was early June. I remember because my birthday is the end of May, and I really wanted a term sheet on my birthday, and I didn't get one that year. I was sad on my birthday. But
that was the last birthday you were sad at, though.
Well, it's happy for other reasons, but sad for no term sheet. So we ended up getting multiple term sheets. And so that was a much faster and more successful fundraise than the one previously. We oversubscribed that round. So I initially had said, hey, let me get another 2 or 3 million to kind of get that initially. Like, I really wanted that 3 million initially to get off the ground. we had a lot of interest, and we ended up oversubscribing and raising, I think, around 3.5 million. But the thing that people don't always think about, and I candidly wasn't prepared for, was it took a long time to go from term sheet to close. So it, between that period of, getting those term sheets, negotiating the term sheet, picking the one we want to work with, and then all of that final due diligence, the company actually ran out of money during that time. And so you're sitting there like, I finally got this amazing term sheet. I've got VCs that are so excited to work with me. We're days away from closing it, and I don't know how I'm going to fund payroll. And so, I had originally gone to the VCs and said, can you do a bridge loan? And can you fund some of this early? And said, no, we don't do that. That's not how we operate. And that's where, the managing partner of my old fund came in, and he said, if you're in, I'm in. And so he said, if you're going to bridge it yourself and you're that dedicated to it, I will give the rest. And so he and I came in together and did that bridge loan to fund payroll for that additional, I think it was about 3 weeks before it ultimately closed, and we had cash in the bank.
Wow. Wow. Amazing story. Okay. And then eventually you sold the company. So tell me what was this always your exit strategy? Was it as a CEO and a founder, do you think about an exit? People call it exit strategy. And I always wonder, why should there be an exit? Like, there's no reason to be an exit. Why can't you just stay and continue? I mean, could become public company. I mean, who knows? So was this happen serendipity? Were you really looking for a buyer? How did this happen?
Yeah. So, I mean, it's funny because you have to have an exit strategy the moment that you take outside investors, right? And so from that day in 2016, I knew that we had to have some type of liquidity event. Had it just been a business that Alex and I said, we don't need any outside funding, and we'll just build it ourselves and we'll take distributions at the appropriate time, we could have done that, but we needed more money to scale. So we knew that we had to have an exit strategy. And so it certainly wasn't something that I was going out and trying to do. We exited the business much earlier than expected in 2021. And so what happened was in 2020, when COVID hit, our product, so maybe backing up, we had started selling to hospitals. We realized, to make a long story short, that it was not the best commercial approach for us. And we started instead marketing and selling the software to the medical device manufacturers who have those team members that are in the room. So those team members saw us, got excited about it, and we realized that was a much better go-to-market for us as a business. So we would, we sell the software as basically an enterprise software with a cost per license for the number of team members from the company that was using it. And the medical device company would bring it in and use it with the hospital. And there was no charge to the hospital in that approach. So we were getting really nice traction, but I think we were still ahead of our time. And so I think we were seen by a lot of people in the industry as a nice to have product versus a must have. And then when COVID hit, I thought the whole business was just going to go kaput because elective surgery was all canceled. So we had this really good pipeline of customers, but everybody was in a COVID frenzy, as they should be, and all those conversations stopped. So I called all of our customers to find out, hey, what do you need right now? And I started hearing the same thing over and over, which was, Jen, we actually need to explore more than we've ever needed it before, because we can't send our team members in the room. But we can have iPads that are in the room that give all of the guidance, that show the proper technique, that could teach people how to use their devices and support them. And the ask was to have the HIPAA compliant video. And so our amazing Chief Technology Officer, Eugene, saved the day and in a heroic way built that into our platform in a very short period of time. And we almost overnight, it seems like, went from a nice to have platform to a must have platform. So, I mean, it was literally a must have. And it's funny, if you go into like the medical device journals of late 2020, it's always what are the best innovations in med tech, and what are the sexiest things in med tech if med tech can be sexy. And we were always on that list of here are the latest and greatest things to do. And so our business grew at just an incredible pace. And in 2021, we started getting inbound offers to buy the business. And so, health tech multiples were very, very high at the time, 2021. It's a different market today. But ultimately it came down to a discussion between myself and the board where, we said, there's always a number. So once you've raised venture capital dollars, there's always going to be a number that your investors are going to be willing to take it off the table for. So if the business is going really great, it's going to be a higher number. If the business isn't going so well, it's going to be a lower number. And we ultimately aligned and said, hey, if there is a certain number, then it would make sense to exit the business today. We worked with an investment banker who was terrific, who ran a relatively short and tight process because we had those unsolicited offers, but we wanted to make sure that, if we were going to sell it, we wanted to make sure that we did a market check to make sure that we were providing the best return that we could to our investors. And so we sold the business to GHX, who is a Warburg Pincus owned healthcare IT company. They're a terrific company that is probably the largest healthcare software company that sells to both medical device companies and providers. And so I think it was a very good home for Explorer to be a part of within their product portfolio. But, as a CEO, I always tried to keep those relationships open so that when the time came, people knew who we were and we weren't having the conversation, for the very first time. So they had a sense of what the business is, what we do, what our growth trajectory was. But it was absolutely not something where, I woke up on New Year's Day 21 and said, this is going to be the year that we sell our company. It was very opportunistic based on kind of the time and the market environment.
This is an amazing journey from when you actually started until you sold the company successfully. And I've watched periodically your progress in fascination and admiration, and was cheering for you in the background. What's next for you? What's now that you sold the company and you are no longer with the company? I know you that you're going to be antsy. You want to do something. So are you in the contemplation stage? What are you thinking about?
Yeah, I'm in the contemplation stage. I mean, I'm staying in healthcare. Healthcare is the industry that I love so much. And I think I'm leaning toward going back onto the investing side. I think there's just so many tremendous opportunities that are in the marketplace right now. And even as a CEO, I still did some investing on the side. So it's just something where I felt like I couldn't resist it. So I love meeting entrepreneurs and seeing new companies. And, going back into investing is a way for me to be able to help support, half a dozen companies at a time, being on their board and helping them grow. But I also love building companies. So I think we'll see what's on the horizon. I'm doing some really, really fun things part-time now, primarily in women's health, which is a sector that I'm incredibly excited about, that is getting a lot of momentum and attention that I think is really overdue. And so for the next 3 months, I'm going to be a mentor with Matter, based in Chicago, for their new accelerator called 51 Labs, that's focused on women's healthcare. Our first cohort of companies, I think it's going to be announced any day now, but it's focused on menopause. And that is a particular area in women's healthcare that I think has been, it's been stigmatized. There isn't a lot of research on it. It's not something people feel comfortable discussing. And I think it's just really been lacking innovation. And so that's just one of the areas that I'm really excited about to spend more time in within healthcare, and hopefully in some way, shape, or form be a part of some new companies that are going out and transforming and improving care for patients.
My next question, and probably my last question, may sound like a cliche, but it's really not. And I genuinely want to know from you, lessons learned. And I think that the way, I mean, we all know that you have to be persistent, resilient, never give up, all of these things that we tell people. And I don't want to downplay these. But what I want you to share with listeners is more along the line of what things really surprised you that were completely not expected, pleasantly and badly. I mean, when we go into this journey, we are always going to be faced by things that we never expect. Some of these are great and welcome, and some of these are horrendous and terrible. And I think through these, you build your resilience and your experience. So can you share some of these with us?
That's a toughie and a deep one. I think one of the things that I wasn't prepared for going in as CEO is it's just everything is so concentrated. And so coming from being in finance and having a portfolio of companies, as the founder CEO, like every high is so high, but every low is so low. And so I feel like every deal that we didn't close, I took very personally, and I took it home with me, and it was really really hard on me. And so I think the more that you can try to take some of the emotions out of it, I would say something that would help, but I don't know that's really possible, right? Like you're building a business. I mean, it's like a baby, and you take things so personally. So I'm trying to think of some of the specific things that were surprising. The time between signing a term sheet and close was absolutely surprising. So that was something that I wasn't prepared for, that I talked about, and kind of that specific surprise. And I think the other piece of it is just the people management aspect. And so it's a tremendous responsibility, not just managing the capital that's come in to build the company, but you're ultimately responsible for, the livelihood of, for me, dozens of people, but for, other CEOs, hundreds, thousands, tens of thousands of people. And so, your ability to keep the lights on, as we say, as a startup CEO, is just so incredibly important to every single employee that is going and, providing for their family, right? And paying for their student loans, and, paying their rent. And it's a big weight on your shoulders. And as the team grew, everything ends up filtering up to you. And so there was a big HR burden as well as the CEO of taking care of all of your employees. And so having employees, in crisis, whether it was a physical health challenge, a mental health challenge, retaining employees in a crazy job market or trying to hire people. Those are all things that I think just surprised me, of the amount of energy and kind of emotions for me that were, tied up in that. Does that make sense?
It does. It does. Jennifer, I can't thank you enough for spending some time with me. I know your schedule is pretty busy and you're traveling, you're on the road, but giving us an hour of your time means a lot. And I can't wait to see the next chapter. And I'm going to be selfish, hoping that I'll play a small part in it. Now
It
that
was,
we're neighbors.
I love it. It was my pleasure being on the podcast with you, and I look forward to many North Shore coffee conversations to build lots of great new healthcare companies together.
Thank you so much.